everybody. I am Hannatu John. I am the program assistant on the Adolescent 360 project in Nigeria. I am here with Dr. Absalom Madawa, who is the Director, Community and Family Health Services in Nasarawa State, Nigeria. We're here at the ICFP in Pattaya, Thailand, and would like to discuss with him and know his thoughts about girl-centered integration or girl-centered programming, looking at the adolescents and youth sexual reproductive health. Thank you for being here. So, sir, I would like to know the work you do is enormous, and you're doing a lot of work in Nigeria. And looking at your office, you interface with lots of adolescents and youth, looking at the sexual reproductive health cycle. So, what do you think is the value in the AYSRH space? What value does it have to the adolescents and the youth?
I'm happy to be here. It's my first ICFP, and of course, I've been learning a lot already. But to your question, we see a lot of value in the work that we do. First and foremost, I will say that we've seen a lot of awareness being created for our adolescents, and we've seen them embrace, the program much more than for me I anticipated. We've also seen how this has transformed families. You see now a situation where you speak to some of the husbands to these adolescent girls, and they tell you that they want to see their wives take up study in the area of nursing, community midwifery, or even community health. So for us, this is something transformative. For me also, personally, I will say I didn't know so much about adolescent health until probably when the Adolescent 360 came with the project in our state. So just a few, but a lot has happened that has been for us value addition to the system, and also as it has impacted our community and our adolescents.
Thank you very much, sir. It's good to know that you see value in it, because the aim of the project is to ensure that these girls are aware of family planning services that can be rendered to them, and also their agency being built so that they can take charge of their lives, make decisions, and also be feel supported by their key influencers as their husbands, their community leaders, and all that. What strategies have you put in place to ensure that this program in the government systems is sustainable? So after the life of the project, what strategies have the government put in place to ensure that there's continuity?
That leaves me with a lot of things going on in my head, because I know we've done quite a number of things to ensure that this is sustained. But let me start from what we are doing on the A360 project. To start with, we have government-led sites where our own people are the ones running it. We also have, and this is very recent. In fact, I just gave your state program manager the go ahead a day before I left Nasarawa to come to Abuja and wrote this conference. The go ahead to use the modified talking guide, you know, in our communities to engage the husbands, and also to speak to some of the adolescents that we have out there. So this talking guide is not only for the interpersonal communication agents for the males, it also includes that for the chief's agents to use to engage the girls themselves. So this is another area. We have ensured that we have captured in our budget, family planning, adolescent health, to ensure that we have sustainable funding. Now we are going beyond that. My stay here, in the ICFP, I've been engaging people strategically to ensure that we get some support for key areas that will influence the adolescent health program in our state. We also have tried to increase our visibility in the state. We started off from 4 facilities. We added 102 in one sweep. So we're in 106 facilities now. We are always looking at collaborative ways to engage with the adolescent and also with the communities. Now we have this engagement that we have with religious leaders. We call it Interfaith Forum, that encompasses Muslim and Christian leaders coming, sit together to discuss issues of adolescent. We've not only restricted it to adolescent health and family planning, we are going beyond, using them in areas of nutrition and the whole spectrum of health. Wherever we have challenges, we know they can be very instrumental and useful. These are some of the things we have put in place just to ensure that we have sustainability.
Thank you very much, sir. That was insightful, and really, it's glad to see that you are integrating what partners have been trying to do to ensure that our adolescents and youth are empowered and also have agency to make critical decisions about their sexual reproductive health. It was a pleasure having you, sir. We are grateful for the opportunity to speak with you.